again, everybody. Thank you for joining us on this episode. So, today I am so excited to introduce you to Orland Garcia. So, he is a hand therapist and he's actually going to do his own introduction. But first, Orland, can you tell me what you're drinking today?
I am drinking an organic Assam black tea from Trader Joe's. So,
Oh, that sounds good.
yeah,
Today I'm drinking a simple green tea that I got from Costco. I actually really like the Kirkland brand teas.
cheers. Um,
Cheers. Orlin, I'm gonna go ahead and pass it over to you. Just go ahead and tell us a little bit about your experience as a hand therapist. Maybe even share some of your background, any other experience you want to share with us.
as far as my background, I went to Cal State Dominguez Hills. I graduated a long time ago. I was cohort 8, 2014. As far as years of practice, I'm going in my 10th year right now. Any other areas that I've experienced? I have some experience in inpatient neuro as well as outpatient neuro. I did dabble in research with hippotherapy while I was in school, and a little bit of peds here and there, but nothing too serious with that setting.
Okay, so how did you stumble upon hands?
Uh, Ironically, it was my cousin. My cousin was she was already on track to do occupational therapy. I initially was a visual comm major, so I was going to go into graphic design and marketing. But I found out very early on how difficult it was to get into that program. And my other interest at that time while I was in college was I was heavily involved in sports. I think my cousin knew that. So she introduced me to the occupational therapy world. And I had a background in taking anatomy and physiology in high school. So I loved that class when I was there. And then when I took it in college, it just kind of um, grew from there, my passion for the anatomy and physiology. So I did my research on occupational therapy, and one of the settings that I came across was hand therapy. So with hand therapy, um, I was already going into like outpatient rehab tech type of jobs after school. But after I looked into hand therapy, I really thought like it was a setting that was my calling in terms of just fitting my interest with anatomy and physiology. Um, and I got into school. In all honesty, you don't really learn a lot about hand therapy in school. But when I did my rotation for my level 2 fieldwork is when I was like, yeah, this is where I wanted to work. It's kind of like a match made in heaven for myself.
Yeah, so that moment, like that moment you discovered your setting, everything just kind of fell into place.
Yes. When I got in, I did all of my research prior to getting into that level 2 setting. And then when I got into the setting and I was learning about everything, all the diagnoses, what you needed to know, and things like that, I was like, yeah, this makes the most sense to me. And for me, it was easy because I already had an interest in the knowing how the body works and things like that. And explaining that to other people, it just kind of fell hand in hand with like my love for sports and just my love for understanding how the body works.
Hmm. Yeah. I mean, it shows. It shows, I mean, 10 years in hand therapy. Like, I hope you've been recognized for all of the hard work that you do because we all know that you put in so much time and effort into all the clients that you treat. And so I'm sure they receive the best of care from you. So that brings me to my next question about what your workload might look like now. So you work at a hand therapy outpatient clinic. So can you just describe a little bit about the average caseload, some expectations that you have as, a residing OT in that setting, and then as you mentioned a little bit like common diagnoses that you see.
As far as work experience and an average caseload, currently I'm hovering around 15 to 16 patients a day. Typically, what's expected, you kind of, it depends on like where you're working, right? So a lot of outpatient places, just because of changes in insurances and things like that, so the expectations change over time. When I started, we were probably hovering around 11 to 13 patients a day, but as you gain experience and a little bit more rapport with everybody around you, as far as like the different doctors and things like that, then that's when your caseload will typically rise. A lot of diagnoses, you see the, the major diagnoses would be like the repetitive strain injuries, such as carpal tunnel. Well, that's a nerve impingement, but tennis elbow, golfer's elbow, nerve impingement diagnoses like carpal tunnel, ulnar nerve entrapment. And then you get like the trauma cases where potentially there's a patient who has a laceration of the tendon, whether it's a flexor tendon or extensor tendon, or you get crush injuries. So it just varies. Depending on where the patients are coming from, will kind of determine like the complexity of the cases that you're going to receive. It just depends on where you're working. For the most part, as you progress, the complexity is going to increase as your experience increases as well. So that's what I would say to keep in mind as far as being in the hand therapy setting.
Okay. So thinking about the transition from grad student to practitioner, how did that look like for you as a new grad going into hand therapy? And what did, I guess, like preparing for this specific setting look like for you?
Um, when I knew I was going to go into hand therapy as far as a rotation, I think the best thing to do is to like ask questions at the beginning. I would prepare as much as possible. Say you get your information of your clinical instructor right away. You can shoot them an email and ask them, questions that you're concerned about regarding the setting. So, for example, um, how can I make my transition as a level two student smoother to start so that I am prepared? So, knowing your anatomy, right? Asking about anatomy, asking about potential assessments that you're going to be doing. Um, in terms of hand therapy, though, you do have to study a lot. So you'll know at the beginning whether or not it's kind of like something that you can see yourself doing. But um, I studied quite a bit while I was a student. As far as like after work, I'd probably study like maybe 45 minutes to an hour every day. I was in my level twos. Um, I think a lot of hand therapists, especially today, I think if you come prepared and then you ask the appropriate questions and things like that, then it'll make your transition as a student easier, because then the hand therapist who is overseeing you is going to take you a little bit more seriously. I think the biggest thing now is if you go into a setting, not just hand therapy, but if you go into a setting and you're kind of like just feeling your way around like the first 2 or 3 weeks, that's 2 or 3 weeks out of your 12-week rotation, right? So it's better to be prepared. That way, you already get the ball rolling. As far as like knowing your anatomy and knowing your assessments, knowing what to expect. The I'm kind of from like the old school mentality. Like it's better to be over prepared than under prepared.
Totally.
You
Yeah.
your level of commitment as a student also. If this is your profession, then um, this is the time to kind of showcase that you're willing to put in the extra, especially to the hand therapist. Because it's not I wouldn't say it's a very easy field to get into. But once you're in, like you always got to push forward. That's the main thing that I would say, as far as like your transition from grad student to practitioner. It's always going to be a little bit difficult at the beginning, but you take every experience that you get, whether it's from your level one experiences, or if you had a prior level two experience beforehand, you take every little thing you can get from those experiences and you add it to your bag when you're going into your level 2 rotation for hand therapy.
Oh, okay. So basically, learning never stops. You're just kind of refining your knowledge base.
Yeah, you can always use, like even if you're a clinician in hand therapy or if you're a clinician in pediatrics, you're always going to take little nuances from your experiences and then you're going to add it to whatever your skill set is, however you see fit. And that's what I would say, helped me also in hand therapy. I did other rotations when I did my inpatient rotation. Honestly, a very difficult rotation as well because neuro is so different, right? You just never know. You have a timeline of um, potential recovery if a patient has a CVA, right?
Mhm.
Uh, Usually they say like within the first 6 months you got to get them going, but you just never know how they're going to progress. In hands, it's a little bit different because there are protocols that we follow, but it's kind of the same thing, right? So um, I took a lot of how my clinical instructor was as a clinician. I took a lot of how he was with his patients and I applied it to how I am as a therapist within the hand therapy setting. So I say take whatever you can get from all of your experiences. I always say to my former aides and to volunteers and interns that I oversee, if you're going into OT, don't pigeonhole yourself into just one setting. Experience everything so that exactly what you want.
Mhm.
Because the more you know avenues you kind of seek, the more you develop an understanding of what you want to do as a clinician or what setting you want to be in as a clinician, right?
Mhm.
So
So it sounds like you kept really strong connections with your former mentors. So maintaining those networks is really important from what it sounds like. I think just in general, right? You want to keep close contact with the people that you learned from in the past, and that would still kind of guide you into your future as a practitioner. For a new grad going into this setting, figuring out like salary versus hourly and productivity standards, what kind of advice or expectations would you want to share with new grads?
it just depends. Salary is going to be dependent on where you work. Um, I stayed hourly for quite some time. When you're in school, where I went to school, um, they really stressed like occupational balance, right? Um, and to achieve that, you got to know what you want as far as a work-life balance. Initially, I was kind of in that like, okay, let me just be hourly for now and just kind of uh, hone my craft as a clinician. And then when I'm ready, let's go salary. So now I am salary. I think as far as money, it just depends. I wouldn't be able to give you like an ideal like number because I everybody starts differently.
Mhm.
From ending, the newer grads. You guys are starting at a higher salary than when we started. So, and then as far as was it what was the other one? Productivity, like what to
Yeah.
expect.
Yeah, what to expect for productivity standards.
Actually, the expectations aren't going to be as high on you as you start within hand therapy. It's going to be dependent on who your clinician was as your CI, so whoever you were learning under, and then how much they were pushing you. And a lot of that is like if you get hired at I think at a place and it's coming from one of your internships or your rotations, that individual is going to be able to tell whoever is employing you like where your skill set is and like what you're ready for. So
Mm.
for me, with my students, I kind of prep them as if we were going to hire them, right? So I kind of tell them like, this is what to expect as far as you gain more experience. This is what you're going to expect as far as productivity. So as I said earlier, I probably was around 11 to 13 patients when I started, and that probably lasted a year or year and a half, and then from there, it was always 13 and up for the most part. But it just depends. It depends on where you work. Some places you'll potentially probably have um, 2 patients per hour. Insurances play a part in that as well, as far as how much time certain insurances give their patients.
Hmm.
Um, those settings, outpatient, obviously, outpatient is going to be different from inpatient. You can do hand therapy in inpatient. You are going to see less patients potentially in inpatient. From my understanding, when I was in my inpatient rotation, there was a hand therapist there. And as far as I saw, it almost looked like she got 45 minutes to an hour per patient. But it just depends on the setting, and it depends on where you're working at. Um, so just keep that in mind too, because insurance and Medicare guidelines and things like that, they're always changing. So um, if you're wondering why the landscape's always changing, it's because the insurances are always changing as well. So when I started, um, I think we were 2 per hour, and now we're essentially 3 per hour. So just knowing the ins and outs,
Hmm.
you all that up. If you're going into hand therapy, you're going to pick it up as you go, though. You're going to kind of understand that. But I think it's just, it depends on who your clinical instructor is. I just like to be super transparent about it when I'm working with students, or even when I'm working with the aides, or potential volunteers or interns who are interested in the profession. So,
Yeah. Okay. So I guess one another good takeaway would be do your research on how some insurance companies reimburse their therapists, or is that
yeah,
something you learn as you go?
necessarily. I don't really, as far as like a hand therapist, like it's good information to know, but like it's not information that you need to be privy to as a hand therapist. It's
Mhm.
just good to understand it. As far as like knowing those things, most of the time it's going to be whoever's in charge of the scheduling up front, or most of the directors and things like that. You do get educated on these things, and you should understand like the insurances as you go, but as depending on where you go, right? um they're just going to kind of educate you on like, okay, how many visits this insurance gets, and then going from there. So I wouldn't say it's like the most important thing to know with hand therapy. As you progress, it starts to make more sense. But um as far as hand therapy, it's more so just getting your knowledge base down at the beginning, and then uh gaining incremental experience and progression throughout your years of experience. So,
Got it. So first start off with the building blocks of the practice and what will help your clients, and then eventually start to acquire the smaller, nuanced type of knowledge, like the ins and outs of the insurance and the, clinic admin work, all of that stuff.
yeah, and that stuff will come. It's the main thing is like you need to get the fundamentals and the foundation down. I think that's the most important thing.
Gotcha.
Hand therapy, it's all a lot of it. It's anatomy and physiology, right? So,
So thanks for sharing all of those really useful, insightful tips for us and expectations. I'm pretty sure a lot of other students who are interested in hand therapy are going to see this and think, wow, okay, that's good to know. So my next question here is regarding certifications. What type of certifications do you recommend for new grads? I know they have the PAMS certification. That one's pretty useful and helpful to have. So what would you recommend for prospective hand therapists?
PAMS is like the obvious one, and then getting your advanced practice. Those are things that, like, if you're gonna go get your CHT, you're gonna need anyways. So you already have to do that. When you're in hand therapy, say you're full time, it's not as difficult to get your PAMS as it would be if you're like just an inpatient. Because you just, you log everything, and then you send it in, and then they approve it. But we essentially almost every patient, there's some type of modality that you're using. So um, those would be the two main things. And then, uh, like as far as hand therapy, if you can get somebody to take you under their wing, and that's, getting mentorship is huge. It is hard, but if you find the right group or you find the right CI or you get lucky with the CI, um, I would say mentorship is pretty big.
Mhm.
But a lot of a lot of the hand therapists, they want to know that you want to do it though. Like if it's not really for you, like, it within your rotation probably whether or not you're going to go into hand therapy, or you decide you want to see what it's like after you graduate, and you'll probably know within the first like 6 months to a year, if you know it, if you know if hand therapy is for you or not.
What's another certification you recommend? I know they have like kinesio tape certifications. What other?
Tape is pretty standard in the profession, but in order to get your advanced practice, you have to have your PAM. So just to
Mhm.
clarify,
Ah, gotcha.
so you're going to go through the board, the California board. So, but K taping is good to know. You could take classes. It's been a little bit more difficult because of the pandemic. So um, I haven't been able to see a lot of like hands-on classes as much as there used to be. But like getting your feet wet, and then um, finding these different places to take your continuing eds to kind of build upon your foundation. Within your first like 2 years, 3 years is good. I would say just because uh, yeah, 3 months, you're not even scratching the surface in a hand therapy rotation. There's so much more to it that you have to like look into. But I think if you have a strong foundation, you're already off to a really good start. So
Oh, so it's nice to know that there's other continuing ed classes out there that they can kind of fall back on just to buff their, make them feel more confident going into the setting. So another question I have here is, I feel like this one is very relative, but I think it's a really important question because a lot of the times when people say clinic etiquette, it might look different to other people. So, or it might vary from specific hand therapy settings. So, in your experience, what are some vital clinic etiquette you'd like new grads and or fieldwork students to know and take with them as they go into, you know, outpatient or even inpatient clinical settings?
uh it's actually a really good question because it doesn't really get taught much, but I come from like really old school mentality where you always have to show respect for everybody in the clinic, right? So um, when you're going into a work setting, just know that you're going into a culture already. So this culture is already set. So you kind of have to feel your way around the work environment and just kind of know, a big part of being a clinician is understanding people. So not everybody's gonna vibe with you. There's gonna be times where just because of the way you look, they may not, you know, want to talk to you or provide you with any insight. Um, but at the end of the day, I always feel like if you show respect to everybody, that's the best thing you can do. Um, I think the one other thing as well is that um, when you go into whether it's inpatient, outpatient, hand therapy, nothing's given. You have to work for it. So um, a lot of the clinicians that I learned under, you hear a lot of certain things that like you probably, you know, um, shouldn't be hearing, but some of the advice you get is just like, well, you'll hear like, oh, you're an adult now. This is your time to figure it out. Or, things like that, or um, depending on your clinical instructor. I got really lucky with my clinical instructor. One of them, and he was awesome. So I was his first student, but he taught me a lot just from me observing. So sometimes you're not going to get all the answers that you're looking for. But even then, as long as you're respectful and you're asking the appropriate questions and you're showing your clinical instructor that whatever setting that you're in, that you're serious about it, most of the time they should take the time to, you know, uh, not give you the answers, but provide you a pathway to those answers, right? That's how I like to work. I will usually provide a pathway to my students as far as where to look. And then I come back and I check back to see if they actually took the path and they did the work. And then I ask them if they did the work. And then if they didn't, I will tell you right now, most of your clinical instructors will probably know whether or not you did or did not, just from their own experience alone, right?
Yeah.
So those are things that, like, especially in hands, I really don't feel like there's any shortcuts. You got to put in the work. But I think that's every setting, like every setting you have to put in the work. But if this is your profession, this is the time to take it serious, especially if you're in your level twos. Those are like, you need to show your clinical instructors, like, okay, you know, this is what I want to do, and this is how I'm going to show you I'm going to do it, and this is how I'm going to put the work in to show you.
Hmm.
And then respect, breeds respect. So hopefully that respect goes both ways, right?
Right.
Um, Always going to be like that. I think I don't really want to sugarcoat it and say, yeah, that's how it always is. But, you know, most of the time, if you're, I feel like if you're a clinical instructor, just me personally, if I'm taking on a student, um, and I have you for, if you're a COTA student or if you're an OTS, right? Um, I took you on for 12 weeks. So, at times a lot of therapists are looking for students to kind of help them as well.
Hmm.
we're It's our jobs to teach you guys. So like if I'm taking you on, then in that 8 weeks or that 12 weeks, hopefully by the end of your rotation, you've learned something, or I provided some type of insight, or I've given you the basis and the foundation for where you can start so that you can progress smoothly into your career, right? So that's what I would say about clinic etiquette and things like that. I think just being respectful to everybody, everybody around, not just um, the other clinicians, the other therapists, the whole staff,
Hmm.
especially your support staff. You know, if I started from volunteer to aide to clinician, and I think that gives you a unique perspective from every, step, from being the volunteer to being the aide to being a therapist. And part of our jobs is to be empathetic, right? So you got to understand, um, your aides are there to help you, but you know it's always good to be respectful to them. It's good to be respectful to everybody in the front office and just everybody around, whether the experience is good or is bad. I think that's just the advice I would give any new grad or any potential new practitioner, going into the work field. So
Yeah. It sounds like clinic etiquette, good, at least good clinic etiquette sounds like at least just showing that you want to be there, maybe getting there, not maybe, but getting there on time, showing your team that you want to be there, and communication, it sounds like communicating with all staff and being cordial. What would be an example of bad clinic etiquette if you can provide one?
I think, especially if you're going into, this is any setting, right? But especially if you're going into a specialty, I think having that mentality that everything should just be given to you. Everything should be handed to you on a silver platter, or you're entitled to this information. When I started, my first 2 years, I basically I took a bunch of classes, and even in those classes, I talked to therapists. I was like, okay, and you get real advice. They just tell you like, this is your time to like showcase and take your career into your own hands and make it what you want it to be, right? Nobody's gonna, there may be a therapist who's out there who's really like, I'll take you under my wing. Sometimes that happens, and you get lucky, and but a lot of times it's not like that. So you have to put in the work, and I think your work's gonna show for itself if you do so. I think having entitlement, especially if you're going into a setting, it's going to probably rub some people the wrong way, but it's also, I don't think it's a good way to start your career. I think you need to put in the work, especially at the beginning, not just for this job, but for any job. That's just how I see it. Other clinicians may see it differently, but I think I try to instill that in my support staff. So a lot of the support staff that I have had an opportunity to work with, like the aides and things like that, I try to instill that same mentality so that if they get into school, they go into their rotations. I always kind of cue them on like proper etiquette, um, good and bad ways to go about it. Everybody's going to take the advice how they want to, though. So it just
Yeah,
depends.
so kind of like I guess one of the things that you actually taught me was knowing what to say and not to say in front of patients. I think that would also be another example of clinic etiquette.
Yeah. I mean, like, a lot of that is you got to know your HIPAA laws and things like that as well, and just um, our profession is we're here to help people. So I think the first thing that you need to know is like compassion is like one of the main things. I can tell when I get like volunteers and things like that and aides, um, whether or not this is kind of like a calling for them, because compassion goes a long way. Um, if you have that compassion, sometimes that's going to guide you too. So we're always going to be in that position where um, at times you're going to have to go that extra mile, right? So I think knowing that, you have to just be privy. I think a lot of it is just understanding different cultures, understanding the diversity of the types of patients you're going to have. So like you said, communication is huge. Also, just having a good understanding of, how your patient's probably feeling, like that goes along with compassion. So the empathy and the compassion, those are going to take you, far. If that's how you really are, it's going to help you along the way. So that's what I would say, kind of helped me. But I've always kind of just been that type of person. So, um, when I see that I'm helping somebody, or we're seeing progress, or even just a simple thank you after a treatment session, I mean, for me that's all I need, like thank you for helping me,
Mhm.
that's
Yeah. Okay, so that brings me to my very last question for you. So, when you're working with, I know you work with PTs occasionally, you also work with COTAs, and you also do have volunteers and aides that work with you. What kind of advice would you give to maybe a first year clinician or a new grad who is barely like starting to work with a COTA and have their own volunteers under them? What kind of advice would you give them in regards to communication and, keeping your workflow? What are some things you'd like to share about that?
um kind of goes hand in hand with the clinic etiquette. Everybody's human, so treating everybody with respect is huge. I think that's the main thing. Having patience for your volunteers and your aides. At times when you get into your groove, there's you kind of find the best way for you to attack the day so that you're going to meet it within whatever the efficiency standards are at your clinic. But with regards to your volunteers and your aides as well, you also have to show compassion. And you have to understand that, you may think a certain way as far as like how you think the day is going to go by, but if you're not compassionate and you're not patient with the volunteers and the aides, um, it may go south. So there's a way to kind of teach them. Um, and I think you have to understand everybody's different. So when I started as a clinician, ironically, all of my aides were my age. And now it's just, I'm starting to get to the age where I'm like, I could potentially be their parents, where I'm like, man, it's a different, it's a different thing that I'm going through right now where I have to understand that too. Um, but same thing with the assistants. When I first started, I worked with a COTA, and she was, I think, 10 years in. So me just having that respect factor, I was looking to her like she was an OT, because I was like, I know you know so much more than I know, but um, it gets to a point where like um, the COTAs, they're kind of carrying you along the way, and then somewhere down the line they start to go to you and say, what do you want me to do with this patient? So what I noticed in the past is like a lot of the older COTAs that I worked with, they're very respectful. So like you learn that. And I think as clinicians, as OTs, when the COTAs ask us for like um, or they want to sit down and collaborate about a patient that you guys are co-treating or whatever, I appreciate that, because at times, sometimes you get COTAs who just do whatever they want. But the main thing that you have to understand as an OT is that you're the supervising therapist. So, as you move forward, you're going to understand that like everything that they do, you're doing with them essentially, because you're co-treating, right? You're co-signing and all that stuff. So having a good relationship and rapport with your assistant is important, because you need to develop that trust if you're going to be a team moving forward, right? Um, as far as working in a setting where there's more than one or two disciplines, like there's a physical therapist or a speech therapist, it's the same thing. Everybody has a goal, right, for their patients. I have background in physical therapy because that's where I was an aide. I wasn't an occupational therapy aide. I started in an outpatient physical therapy aide position, and then even in that, what I tell my aides is observe. Like every clinician. I was always a sponge. Like that was just me, where I was just kind of like, okay, this is how it is in PT. This is how it is in OT. And there's always going to be, a schism between the two professions. But I have a lot of respect for physical therapists. They do great work, So um, I still talk to a lot of physical therapists, and I still kind of do a lot of, leisure activities with physical therapists too. So I think that's important to keep in mind. As far as you know another thing I could say is with your codas and things like that, especially if they have more experience than you, respect is huge. Like for me, it's always about respect. It's just, if they have more experience than you, then respect that. Take what they have to say and then divvy it up. At the end of the day, it's going to be you. But like, just because you're the clinician and you get your degree, whether it's your master's degree or your doctorate degree, at the beginning, you're still learning. So, if you don't respect people, it's going to come back. I'm big on karma as well. It'll come back to you, maybe one day um, you'll need help. And then you may have not been great to, a COTA or a clinician, and then you're going to need their help. You just never know, right? So I think good things come back to those who, provide good things or provide good vibes and things like that. So I think one of the main things I would say, you know, as far as working with other professionals and working with an assistant and having aides and volunteers within your scope of practice.
Yeah. That sounds like, again, communication and knowing that the ultimate big picture is just working as a team, because ultimately the client's goals are the main priority.
Absolutely. Like my main thing is like it's always like I tell everybody on our side, I was like, we're here for the patients. So you have to understand that if we're not doing anything, what can we be doing for the patients, or what can we be doing for you know whichever patients are in need of help, or how are we achieving our productivity goals? How are we being more efficient? Just things like that. Um, but at the end of the day, I always say if we're not doing anything, if you don't have anything to do, think about what we could be doing for the patients first. So um, yeah.
Well, Orland, thank you so much for sharing all of the amazing insight that you have. I'm sure that a lot of, prospective students and prospective hand therapists are going to watch this and find some really useful things that you shared with us. So again, thank you so much for your time. Again, for the viewers, if you have any other concerns, pressing questions, please feel free to email us. We really, really appreciate all of the insight, and we also appreciate any kind of concern that you might have. We are an open book, and we hope to answer all of the other questions that you guys have. Thank you.
All right, you're welcome.